Hello friends, today we are going to discuss another topic, flu or influenza. It's either the flu or love. The symptoms are the same. I am Dr. Jagatjit Singh Virk, presenting to you this topic. What's flu? Flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. The flu is caused by influenza viruses that infect the nose, throat, and lungs. These viruses spread when people with flu cough, sneeze, or talk, sending droplets with the virus into the air and potentially into the mouths or noses of people who are nearby. Timeline. Typically, flu may progress as follows. The virus infects a person, usually through their nose or mouth. After one day, they may be able to transmit the virus to others. Symptoms appear 1 to 2 days after infection. The chance of transmitting the virus is highest 3-4 days after symptoms appear. After 4 days, the fever and muscle aches improve. After 1 week, most symptoms disappear. The risk of transmitting the virus disappears 5 to 7 days after symptoms appear in the patient. The cough and tiredness may remain for a further week. Which virus caused corona? Here are the few. SARS-CoV-2 is responsible for COVID-19. SARS-CoV, severe acute respiratory syndrome called SARS. MERS, MERS-CoV, Middle East respiratory syndrome, MERS. HCoV, NL63, HCoV 229E, HCoV OC43, and HKU1. Usually mild respiratory illnesses are noted with these viruses. How long the COVID patient contagious? By the 10th day after COVID symptoms begin, most people will no longer be contagious as long as their symptoms have continued to improve and their fever has resolved. People who test positive for the virus but never develop symptoms over the following 10 days after testing are also probably no longer contagious. Can you have flu without fever? The flu is a viral infection that spreads easily. It can occur without a high temperature or fever, but typically does include this symptom. A fever is the body's reaction to the infection and helps it fight back and recover. How long do COVID symptoms last? Those with a mild case of COVID-19 usually recover in 1 to 2 weeks. For severe cases, recovery can take 6 weeks or more, and for some, there may be lasting symptoms with or without damage to the heart, kidney, lungs, and brain. How fast you can recover from flu? Flu symptoms, including fever, should go away after about 5 days, but you may still have a cough and feel weak a few days longer. All your symptoms should be gone within 1 to 2 weeks. What are the stages of flu? What to expect with the flu? Days 1 to 3, sudden appearance of fever, a headache, muscle pain, and weakness, dry cough, sore throat, and sometimes a stuffy nose. Day 4, fever and muscle aches decrease, hoarse, dry or sore throat, cough, and possible mild chest discomfort become more noticeable. Day 8, symptoms start decreasing. Signs and symptoms. Flu signs and symptoms usually come on suddenly. People who are sick with flu often feel some or all of these symptoms. Fever or feeling feverish chills. It's important to note that not everyone with flu will have a fever. Cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. Flu complications. Most people who get flu will recover in a few days to less than 2 weeks, but some people will develop complications such as pneumonia as a result of flu, some of which can be life-threatening and result in death. Sinus and ear infections are examples of moderate complications from flu, while pneumonia is a serious flu complication that can result from either flu virus infection alone or from co-infection of flu virus and bacteria. Other possible serious complications triggered by flu can include inflammation of the heart, that is called myocarditis, brain encephalitis, or muscle tissue myositis, rhabdomyolysis, and multi-organ failure, for example, respiratory and kidney failure. Flu virus infection of the respiratory tract can trigger an extreme inflammatory response in the body and can lead to sepsis, the body's life-threatening response to infection. Flu also can make chronic medical problems worse. For example, people with asthma may experience asthma attacks while they have flu, and people with chronic heart disease may experience a worsening of this condition triggered by flu. Colds versus flu. Signs and symptoms in cold and influenza. Symptoms onset. In cold, it is gradual, and in flu, it is abrupt. Fever, it's rare in cold and common, lasts 3-4 days in flu. Aches, slight in cold and common, often severe in flu. Chills, uncommon in cold and fairly common in flu. Fatigue, weakness, sometimes in cold and usually present in influenza. Sneezing, common in cold and sometimes in flu. Chest discomfort, mild to moderate in cold and common, can be severe in flu. Cough, hacking cough is there and severe in flu. Stuffy nose, common in cold and sometimes in flu. Sore throat, common in cold and sometimes in flu. Headaches, rare in cold and very common in influenza. What should you eat with the flu? Consider eating the following foods when you have the flu. Broth, whether you prefer chicken, beef, or vegetable, broth is one of the best things you can eat when you have the flu. Chicken soup is there, garlic, yogurt, vitamin C containing fruits, leafy greens, broccoli, oatmeal. How can I cure the flu fast at home? 9 tips to ease flu symptoms. Stay home and get plenty of rest. Drink plenty of fluids. Treat aches and fever. Take care of your cough. Sit in a steamy bathroom. Run the humidifier. Try a lozenges. Get salty. How can I prevent the flu naturally? Natural flu prevention tips. Wash your hands thoroughly and frequently. Although the flu is an airborne illness, it is often transmitted by shaking hands and touching frequently used surfaces. Keep your space. Try to stay about 6 feet away from others when possible. Stay active. Sleep tight. eat a nutrient-rich diet. Which fruits are best in flu? Best fruits that fight the winter cold and flu. Kiwi fruit. The fuzzy green fruit is jam-packed, full of vitamin C and E, which help fight against those pathogens that try to do us harm. Apples. It may be true what they say about an apple a day and keeps a doctor away. Bananas, citrus fruits, blueberries, pineapple, watermelon, and strawberries. What is the best tea to drink if you have a cold? Herbal teas with honey. Herbal teas are naturally decaffeinated, so they won't dehydrate you. They often carry a sweet flavor and soothing scent. They taste especially good with a natural sweetener like honey. Chamomile tea and peppermint tea have long been a favorite of people recovering from the common cold. Precautions. The flu is not usually serious, but it is unpleasant for some people. However, complications can arise. Some of these can be life-threatening. Complications include bacterial pneumonia, dehydration, worsening of chronic medical conditions such as congestion, heart failure, asthma, or diabetes, sinus problems, and ear infections. The risk of experiencing severe symptoms and flu complications is higher in the following cases: adults over 65 years of age, babies or younger children, pregnant women, people with heart or cardiovascular disease, individuals with chest problems such as asthma or bronchitis, people with kidney disease or diabetes, individuals who are taking steroids, people undergoing treatment for cancer, anyone with a weakened immune system. These are all vulnerable for the flu infection in a very, very hard way. Thank you very much.